Hiccups, medically known as singultus, are involuntary contractions of the diaphragm muscle, followed by sudden closure of the vocal cords, resulting in the characteristic hic sound. While the exact cause of hiccups is not always clear, several factors can trigger this reflex. 1. Distension or irritation of the stomach, eating too quickly, consuming carbonated beverages, or overeating can distend the stomach, irritating the diaphragm and triggering hiccups. Similarly, spicy foods or hot liquids can irritate the esophagus, leading to hiccups. 2. Swallowing air. Swallowing air, either while eating or drinking, or due to habits like chewing gum or smoking, can lead to hiccups. The air may accumulate in the stomach, causing distension and stimulating the diaphragm. 3. Sudden changes in temperature or pressure. Exposure to sudden changes in temperature or pressure, such as swallowing cold drinks or entering a hot environment, can stimulate the diaphragm and trigger hiccups in some individuals. 4. Nerve irritation or damage. Hiccups can sometimes occur due to irritation or damage to the nerves that control the diaphragm or the reflex arc involved in hiccuping. This can result from conditions such as gastroesophageal reflux disease GERD, phrenic nerve irritation, or central nervous system disorders. 5. Emotional factors. Strong emotions such as excitement, stress, or anxiety can trigger hiccups in some people. The connection between emotional states and hiccups is not fully understood, but may involve the autonomic nervous system. 6. Gastrointestinal disorders. Certain gastrointestinal disorders, such as gastroesophageal reflux disease GERD, gastritis, or inflammatory bowel disease, may be associated with frequent hiccups as a symptom. 7. Medications or substances. Some medications or substances, including alcohol, opioids, benzodiazepines, and certain chemotherapy drugs, may cause hiccups as a side effect. 8. Medical conditions. In rare cases, hiccups may be a symptom of an underlying medical condition, such as stroke, brain tumor, multiple sclerosis, or kidney failure. Persistent or severe hiccups that last for more than 48 hours may require medical evaluation and treatment. In most cases, hiccups are harmless and resolve on their own within a few minutes to hours. However, persistent or frequent hiccups that interfere with daily activities or are accompanied by other symptoms should be evaluated by a healthcare professional to determine the underlying cause and appropriate treatment. Please comment on what you want in my next video.